In today's day and age, it's so important to know how verbal communication helps employees connect with their patients, and also how verbal communication really helps patients be able to express themselves and express the things that they want to be able to tell, for example, dental assistants in their line of practice. But this goes for more than just dental assisting. But as someone who will be working in the dental field, verbal communication is just so important because you need to be able to talk efficiently with your patient and really be able to let them tell you any questions or concerns that they may have. So in this essay, I went over some different things that were covered in chapter 61, and basically just how verbal communication is so important, and how word choice, voice quality, listening skills are all valuable things that dental assistants need to take into consideration. For example, in my essay, I did include an example of how dental assistants need to be sure to use common language when speaking to patients. If you're talking to a patient and you're telling them that you're going to take an impression and you're going to be using alginate and it's going to be fast set and you're using a quad tray or a full tray, they're not going to be able to catch on to many of these terms. So what a better way of doing that would be to kind of bring it down to common language that they would be able to understand. So for example, instead of saying I'm going to take an impression and use alginate to do it with, in my essay I included that they could possibly say that they're going to be taking what's known as an impression, tell them what that is, tell them how that allows the dentist to study the position of their teeth or to help them make a temporary crown or whatever it may be, and then explain that the gooey material in the tray is alginate. Explain that it'll only be in the mouth shortly, that it's uncomfortable, that it might not taste the best, but that it's only going to be there in a moment, and then, explain to them why it's necessary. Because sometimes, if you're not explaining things, people can misunderstand. They may think, oh, you don't care that, you're putting this in my mouth, that I could possibly gag. So you really need to take into consideration how the patient's feeling, that they're okay with what you're doing and that they're comfortable. Another part of chapter 61 is also explaining the importance of voice quality. Voice quality is more important than what you may think. For example, in my essay, I said sometimes it isn't what's being said, but it's how you say it. So if you're trying to talk to a patient about a type of treatment, that the dentist has recommended, and say that they're being very argumentative, or they're just saying that they're not comfortable with it, that they don't see why it's necessary or why they should spend this money on it or this or that, try being patient with them. Allow them to express their opinion, and try to be enthusiastic and understanding at the same time, though, and just kind of explain to them, why maybe it is necessary, but also explain to them that you do understand where they're coming from and why they may not be okay with doing it. Because sometimes that's all you can do, and you do have to be understanding of people and of people's abilities to pay for things. Not everyone has the money to do certain treatments, and that's something that dental assistants and dentists even have to take into consideration too, that yes, the patient may care about their mouth and their teeth and their oral health, but they may not have the means to pay for it. So that's something too. And then going along with voice quality, if you're having a negative attitude towards a patient, or you're having a difficult patient, instead of being negative to them, you need to still make sure that you're presenting a positive attitude. whether, you're not having the best day or you're having other things going on in your life, at that time, you're their dental assistant. They are your patient, and you need to make sure that you're taking the best care of them that you can. And to leave personal things outside of work. It's also better to be enthusiastic and have better voice quality, and say things with enthusiasm and a positive attitude, because if you're being negative and you already have a patient who doesn't want to come to the dentist, or say you have a patient that comes in saying that they don't like the dentist, that they haven't been to the dentist in 20 years, and then you're being really negative towards them and you're giving them a really bad attitude, you're going to make them feel more self-conscious, and you're going to make them feel like they don't belong. And that's something with verbal communication. People want to feel like they belong, and they want to feel like they're being accepted. So, whether or not you have any kind of personal opinion, that needs to go away. You need to make sure that you're taking the best care of the patient that you can, because it's about the patient. And patient care is one of the most important things in dentistry. Other parts of Chapter 61 also include being able to ask the patient questions, and then being able to exhibit listening skills as well. So not only do you need to be able to ask open and closed-ended questions to be able to gain information from the patient, it kind of lets them know that you're engaged in the conversation as well. So, if you're asking them, what kind of pain they've been exhibiting, or, maybe they mentioned to you that they don't like coming to the dentist. And so you ask, did you have a bad experience? Maybe we can make this experience better for you so that your future dental visits will be in the better of your interest. Also, just taking the time to listen to your patients and what they have to say can make all the difference as well. Sometimes people just need somebody to listen. And that also lets them know that you're engaging in the conversation. If you're sitting there, you're already behind a mask, you're behind glasses, even, more PPE now, they can hardly tell your facial expression anyway. But, you can say a lot with your eyes, and you can say a lot, even with half of your face covered, you can still say a lot with your facial expressions, and that's something that you need to keep in mind. And even if you don't have any PPE on and they're talking to you about an issue or something that's going on, you still need to make sure that your facial expressions are corresponding with the conversation that you're having. You don't want to give them shocked looks or anything that looking wide-eyed that can make them nervous. You just want to remain calm, put a smile on your face, make sure that they know that you understand where they're coming from, make sure that they understand that you want them to be as comfortable at the dentist as they can possibly be. Overall, throughout this chapter, verbal communication is so important in dentistry. It's so important outside of dentistry as well, but as a dental assistant and as someone who will be working in the dental field, I just feel that without verbal communication, there's no way that you would be able to know how your patient truly feels, if they're comfortable with the treatment that you're doing, if they're comfortable with the options that they have, if they're comfortable having their x-rays done. Verbal communication allows you to be able to communicate with the patient and to be able to get what the patient needs. But it also allows the patient to know what you need. If you need them to reposition themselves, if you need them to maybe work on their oral hygiene more, like if a hygienist was giving post-care instructions or periodontal treatment instructions, they would need, obviously, verbal communication in order to relay this information, and if the patient has any questions as well. So overall, communication is important in both verbal and nonverbal ways. I included that in my essay. And just overall, that it's so important to show the patient that you are engaged in the conversation and that you are definitely willing to answer any questions or concerns that the patient may have. Thank you.